That's okay. We're going to go to your speaker view. And what I'm going to do is set up a couple of things so I'm not bouncing back and forth quite so much on the program itself. So anyway, again, good afternoon. This is Ann Church with Villages of Santa Fe, and this is our workshop, Medicare 101. So today we're going to be talking about original Medicare, but we want to talk about next in 2 weeks, Brad, we're going to have our program, Original Medicare versus Medicare Advantage. And that's going to be a situation where that's where everybody's getting bombarded with questions. And so what this program is going to talk to you about Original Medicare, and then in 2 weeks, we'll talk about your Medicare Advantage. Also coming up is our fall prevention program. Falls are the leading cause of death in seniors. And we have been doing fall prevention programs. Maria Francis and I are both certified master trainers for a matter of balance for the Department of Health. And we hope you will join us on the 14th at 9:30 a.m. Zoom time. Forward the slide. So what we do, Villages of Santa Fe, our goal is to keep our older generation healthy. Every year, 1 out of 4 Americans age 65 falls. Falls are the leading cause of fatal and non-fatal injuries among older adults. And exercise is the only way to prevent falls. Villages of Santa Fe makes exercise and life programs available for older adults 24/7 through our online and in-person classes. And we also have a library of over 650 videos. And we want to thank today Nurses with Heart for providing us this wonderful space like they have. And they provide wonderful home health care here in Santa Fe. Again, if you would please put your questions into the chat, that'd be great. Next slide. So our speaker is Brad Coe, the president and managing member of Coe Agency, LLC. And he has a business partner of his wife and his daughter, Emily. So Brad has been presenting this program for Villages since 2016, and he provides us many insights into the world of Medicare. And he's also helped us individually, because many of us I feel free to call up Brad or send him an email and say, I got a problem, what do I do? Brad's been in the insurance industry for over 22 years, and he focuses on Medicare while his wife and daughter handle the group insurance. So what I'm going to do now is change my microphone over to Brad, and we will have him. Let's see, microphone there. So good afternoon, Brad.
Good afternoon. Thank you, Ann. First of all, I always have to get taken care of some housekeeping. First and foremost, this presentation is classified as educational. Medicare does have different classifications. Educational is this classification, and what that essentially means is that we're going to be talking about a lot of things, but very much in general terms. There won't be any specifics about a said company or about any other kind of things that a particular plan may have in place for it. So that's the first thing. The second thing that I have to make clear is that I am an independent agent. So I have a company. I end up getting appointed with different insurance carriers. And then if somebody needs assistance, then I can assist them with that. I am not an employee of Medicare. So that is a very big distinction that I have to go ahead and make. And like Ann said, please go ahead and put your questions in the chat. And if you will allow me also on the questions, that if it is something of a more personal nature, then I may ask if I could answer that at the end of the seminar. But a lot of times these questions really do pertain to everybody. So I've got no problem answering some questions. Okay. So with that, let's get going. We got a lot of stuff to go through. I want everybody to also know that there are a lot of slides. This is the Centers of Medicare and Medicaid, CMS, where actual presentation. So there are a lot of slides in this that we will be kind of not spending a very lot of time on them. So because they're really very more particular to a certain type of person in a situation. So getting started with Medicare 101, what we're going to go ahead and do is go over what is Medicare, original Medicare, Medicare supplements, or Medigap as they're also known, Part D, Medicare drugs, and then we're going to be ending on the Medicare Advantage and other health plans. So that way, you'll know everything that's coming at you with when you're coming up to Medicare, or everything that's being sent to you in the in your mail right now, and what everybody's calling you about and what all the commercials are about. But there won't be anything specific about any of this. If anybody is interested in these other topics, low income subsidies, that's coming to be a big deal, please just let Ann know, and I'd be happy to go ahead and share this information with you, okay? So without any further ado, we just, again, want to go through this and be careful, because a lot of people, a lot of you may be looking at your Medicare Advantage plan, and when we are going to be starting with original Medicare. So, and then we're building on top of that. So I want to be sure that when we're looking at certain things, you're going to say, well, wait a minute, I don't have that deductible. Correct, because this is dealing with original Medicare, and you have a Medicare Advantage plan that ends up umbrellaing it. So please kind of stay with me when you're doing this, that we're going to be talking about Medicare, how you're eligible, and then what original Medicare is, and then we'll be getting into the other components that you deal with, okay? So what is Medicare? Medicare is an actual health insurance, and this is overlooked many times. It's an actual health insurance, but nowadays in health insurance, we don't deal with what your health is, unfortunately. It pretty much is, are you eligible for this product? And that's really what everything is nowadays in health insurance. So for Medicare, in order to be eligible for Medicare, you've got to be at least 65 years or older. You can get it earlier under some disability, and also you can get it with Lou Gehrig's disease, and also new to this year is the end-stage renal disease that they have for that, because that used to be a separate component and now it's part of Medicare. Amen. There are two, well, there's three, but we're only going to be talking about two because it pretty much pertains only to everybody unless you work at the railroad. There are two federal agencies that handle Medicare, and this is where it can be a little confusing also. The agency that we mostly are concerned with is Social Security, but the Railroad Retirement Board, if anybody's involved in that, they pretty much handle what Social Security is. So we're going to be talking about Social Security. And then there's also the Centers of Medicare and Medicaid. And Social Security Administration handles the enrollment and the premium collection. So if you have a question about whether your enrollment went through or what is your premium, okay, that's directed towards the Social Security. Centers of Medicare and Medicaid, they're the ones that administer the benefits. So once you have this and you're using it, then they are the ones that will go ahead and process the claim on this. This slide is missing one thing, because there are four components of Medicare: Part A, Part B, Part C, and Part D. The Part A and the Part B are what we consider original Medicare. And so forgive me, I'm going to do my best to go ahead and refer to original Medicare A and B as original Medicare. But as most people do, when we say, I'm going to have to enroll in Medicare, what we're talking about is original Medicare. So I want to be more specific about it so you know exactly what I'm talking about. When we end up getting to Part D, that's the prescription drug plan. The federal government in 2005 ended up coming up with a prescription drug plan for Medicare. They had it before, but it was kind of incorporated into different policies. This one ended up coming up out of the government, and that's where they had it. And then we had Part C, which are Medicare Advantage plans. And that's where the program where a private insurance company can go ahead and develop their own Medicare plan. It's got to be as good or better than Medicare, and it can have some extra benefits. So we're going to be going through all of that, but everything, the foundation begins with original Medicare, Part A and Part B. And this slide is probably what I would consider the most important slide, because this tells you exactly what we're talking about, what you are going to have to do as a Medicare recipient or coming into Medicare. So here we go. As you can see from here, we've got everything is original Medicare. Now, if we wanted original Medicare as our primary insurance, so when you go to the doctor and they say, who's your insurance company, you would say Medicare. If we wanted original Medicare to be our primary insurance, hospital Part A, medical Part B, then we would end up adding a prescription drug plan for outpatient. And a lot of times we end up adding the Medicare supplement or Medigap plan to hedge your exposure of original Medicare that we'll discuss in a little bit here. But I call this my four-legged stool because we actually have four separate components that comprise your one comprehensive health plan. So we'll break into each of those here in this seminar. Over here, what we're talking about is, yes, you have Part A and Part B, but they are not your primary insurance. The insurance company's plan is now your primary insurance. You keep A and B active. You still have to pay the premiums. A lot of these plans, I mean, everything is packaged together. They're very efficient, and there is a lot of value in these plans. They offer prescription drug plans. So again, we're not adding a separate component. It's incorporated in it. There's some extra benefits here. Again, we'll kind of be going over these a little bit, but not a lot, but you hear it on the commercials. You can get dental, you can get vision. So they can add other things that original Medicare, hospital and medical don't incorporate in them. So, so this slide really, it tells you everything you need to know about what you're going to do. You got to get original Medicare, and then we choose which side we want to go with. And they have pros and cons, each of them. And if we have this side over here, the four-legged stool, then we comprise our plan with a prescription and a supplemental plan. Over here, we choose the carrier plan that's going to be most suitable for you and go with it that way. But everything starts here with original Medicare that we get enrolled in through Social Security Administration. So this kind of goes over a couple of the pros and cons of the differences between original Medicare and a Medicare Advantage plan. I don't want to spend a whole lot of time, but again, we talked about the doctors. So again, your network, which they don't like to use that word because it's not really a network where they got contracts. It's just the doctor will agree to accept Medicare, but in our vernacular, network is what we're used to using. So any doctor or hospital that takes Medicare. So when we're talking about being in a city, we won't be deterred from going from one hospital system to the other hospital system. We could go to both, whomever we chose. On the Medicare Advantage plan, we are going to be dealing with an actual contract network. And that's kind of where we start to get into, I give an analogy of a funnel. At the widest mouth of the funnel is all the providers who accept Medicare. And then we get down a little bit into a thinner part where we get into doctors that may have a network. And we'll discuss more on this later, but referrals, the thing about original Medicare is, again, you have a lot of freedom with this. You don't have to go through a primary care. You just are able to go out and ask, go to a provider, and you get care right there. It's not having to parlay off of something else. But with Medicare Advantage plans, again, sometimes you're going to need a referral. And then we kind of get into some other pieces here that are very quick. I mean, Part B, covered services, we'll go over those a little bit, but there is some exposure that we will always try to go ahead and get the Medigap at the bottom here, the Medicare supplement plan, to take care of. You're going to have to pay a monthly premium, but that's on both sides. On a Medicare Advantage plan, your policy may have out-of-pocket costs that vary because different plans do different things. And that's when I said, which is most suitable for you. We don't use the word which is the better plan. Better is a subjective word. I may think that the Red Sox are the greatest team in the world. My Yankee friends out there will go ahead and say, no, the Red Sox stink and the New York Yankees, but that's my opinion. So what we're talking about is suitability, is setting up your criteria for what you feel is important, like getting into your doctors, covering your prescriptions. And that's how we go ahead and work into this. On this kind of plan, you do not need a supplemental plan, a Medigap plan, because everything is incorporated in it. Very efficient, very clean. So then we get into original Medicare ends up medically necessary services. This is where original Medicare was created in the old school of insurance, where it's medically necessary. So when we talk about something like, let's say, vision, if somebody had cataracts, well, then that would be covered under original Medicare. But if you just want to go get your eyes checked and buy a pair of glasses, that's not medically necessary. So right now we start to hit what would I say? Not necessarily a limitation, but the difference between the two policies that we end up having. Again, we're going to have a separate drug plan if we so choose. So a lot of times on Medicare Advantage plans, it's included in it. And on Medicare Advantage plans, these are county-based plans. So they call that the service area. And so if you are in a service area, and we get your zip code first and foremost to know what counties you're in, and that will help to know what plans are available for you. If you were to move out of the service area, we would need to look at a different plan because you're no longer in that area. So again, some more of the differences, nothing that's horrible. It's just you have to understand that and take that into consideration. Original Medicare doesn't cover medical expenses outside of the United States, but you potentially could get something covered or reimbursed, if you will, if it was an emergency. But the key word here is potentially. But that, again, comes into why we might go ahead and put in a Medicare supplement or Medigap plan with that, because that does help out with foreign travel on some of their plans. And on a Medicare Advantage plan, Yeah, they don't cover outside of the United States, but a lot of the plans will go ahead and have worldwide emergency or urgent care coverage so that if you have to go to the emergency room because you ate some bad pasta while you were traveling in Italy, okay, you can go to the emergency room. They're not going to bill your insurance company. You're going to have to pay for it and then come stateside and we can go ahead and submit a claim. So that's kind of how this all works here. When enrollment is automatic into Medicare, when you are collecting Social Security before age 65, because they know that you're turning 65. If you're not collecting Social Security, it's not automatic. And that's why we're going to get into, the periods that you can go ahead and when you can enroll and when you're not allowed to enroll on this. For the disabilities, again, very quickly, if you become disabled and if you're on it for 24 months of disability, Social Security disability, then they end up enrolling you in Medicare. So that's the only automatics that we end up getting. We always want to, when you're coming up to this, get ready for Medicare package is always a great thing. I mean, I see both of our people that are here today have their booklet that tells you an awful lot of things, but you're going to have to look forward to that. And we have to get your Medicare card. So apply. You can apply at Social Security. So you can do it online, ssa.gov, or you can call them, or you can make an appointment at the local office. And you can enroll in Medicare up to 3 months before the month of your birthday. All right. Medicare will go into effect the first of the month of your birthday, unless you're born on the first, and then we move everything back a month. Again, we're not going to deal with those guys with a railroad. You'll get, once you're enrolled in Part A and Part B through Social Security, then you'll end up getting your Medicare card. Really, these guys are kicking these Medicare cards out very quickly. So I'm seeing within 2 to 3 weeks of you enrolling that you end up getting your red, white, and blue Medicare card. And it tells you the information, what they have your name as specifically. And you're like, well, I don't use my middle initial ever. That doesn't matter. This is how they know you. And that's what we want to go ahead and make sure that they know specifically who we are enrolling. You'll have your Medicare number. Used to be the Social Security number with a letter at the end. Now they're doing these 11 digits that have numbers and alphabet in there. And then it has the start date of when original Medicare happened. So Part A, hospital, and Part B. So, all right. What I said about if you don't have Medicare, then you're going to have to initiate the enrollment on yourself. So if you don't already have Medicare, then what we start to talk about is, what am I eligible for this? So not only am I 65, am I a citizen or legal resident, am I disabled? You got to fit into that category, the criteria for whether you're available. And then we have to fit into an enrollment period for this. And the enrollment period that we most deal with is the initial enrollment period. There are these two others. The SEP, or special enrollment period, would be, again, in certain circumstances, life changes, that kind of stuff. And we'll go through those, but you'll understand when I kind of go through those. And then the general enrollment period would be if you missed your initial election period, the general enrollment period comes around every year that you can enroll in this. If you already have Medicare and want to change, we have an open enrollment period That's coming up here October 15th through Pearl Harbor Day, December 7th. You also, if you're on a Medicare Advantage, a Part C plan, they have another open enrollment period at the beginning of the year. And then again, there's an open enrollment period for people who are institutionalized. So you're in a facility. And then you have your special election period. So here we go. This is what we're talking about with what your initial enrollment period, you're coming up to age 65. And this is why everybody starts getting phone calls and all of their stuff in the mail when we start to turn 65. They're sitting there, the carriers know this, and they're reaching out to you so that you can enroll potentially with them and their initial enrollment period. If you have your month of the birthday, so I'm born in April, then I could go ahead and enroll up to February? No, January, February, March. I could enroll in original Medicare Part A and Part B for an April 1st effective date. Now, these 3 other months after this, you can sign up after the month of your birthday, and your effective date then becomes the 1st of the following month. So if I decided not to enroll and have April, or I forgot or something, and let's say I enroll in April, then it will end up being May that I end up getting my effective. But as long as you do it within this 7-month period, you'll avoid any penalties. And this is what I want to let you know right now, in case I don't say it later, is you have, some of these things are voluntary. You don't have to go ahead and enroll in a lot of these things. But if you were to ever come back and get enrolled in them, then that's when you're going to have a penalty. The program is set up where they want everybody enrolled when they're eligible to be enrolled, because that's the law of insurance. They need numbers in there to go ahead and spread out the risk on everyone. All right, so special enrollment periods, again, we have certain life circumstances, typically what we deal with. This is a group health plan. We would have, so you continue with your employer health plan and you don't go on original Medicare, but now you've decided to retire. Okay, there's a life change. So you would have up to 8 months. There's to enroll in this. General election period, again, if you end up missing your initial enrollment period, then we can go ahead and enroll January, February, March of this and the coverage begins the first day of the month after you sign up. But again, we may end up, if it's past 12 months, then you're going to end up realizing a penalty. The Consolidated Appropriation Act, the CAA, ends up introducing a new special enrollment period. And I typically wouldn't go over this very much, but it is one of the new aspects of Medicare. Everybody's been hearing that there's some new things coming in. This is one of them. And what they've done is stated that you can have a special election period based on whether there was an emergency or a tragedy that is in your area. So for instance, our governor has gone ahead and declared a state of emergency because of financial destitute. Okay, we now have a special election period that we could use to go ahead and change. What's more applicable and what might help describe this better is like somebody who is in a forest fire area. They don't expect you, or they're not going to penalize you for not enrolling on time if you're trying to save your house. But that's where all of this kind of comes in, where we can have this. So what we end up having is the special enrollment period starts the day the federal, state, or local government declares the emergency. And these are real. You go onto the FEMA website. A lot of the carriers have the emergencies that are available. They will tell you if it's going to end in 6 months, or they'll tell you if it's ongoing. And then it ends up, coverage starts the month after the person signs up. So again, we're pretty much talking about a one-time enrollment into something based on a special election. This is some other special elections that we'll go through. So again, you're with an employer, you're formerly incarcerated, termination of Medicaid. That's a big thing right now. Other exceptional conditions. So these are all examples of what you can go ahead and get into with a special election period. Also, on the on this act, we end up having extends immunosuppressive drug coverage for Medicare kidney transplants. Medicare kidney transplants are really, our kidney transplants are actually becoming fairly common now. And now Medicare itself, original Medicare, has more, will cover more immune suppressive drugs. They're available to individuals whom Medicare coverage ends or will end 36 months after the month in which the individual receives a kidney transplant. So you can get this and prior to Medicare, or you can get it during Medicare, and you will go ahead and still be able to have it for at least 3 years. Here's just some more about the immune. And here we have our yearly open enrollment period. Most of the time we know this as the annual election period. Begins October 15th, goes through Pearl Harbor Day, December 7th. This is when you are established in Medicare, or you haven't been established. We can still enroll you at this point if you're not established in Medicare, but we go ahead and look at it, and you can change a lot of your Medicare products and information and stuff with a guaranteed issue for a January 1st effective date. Now, what we also talk about is on December 7th, I mean, we have until midnight of December 7th to do that. So we need to take that under, just if you, I don't know, are on vacation and all of a sudden you're like, what the heck do I do? So what we have now with a Medicare Advantage. So again, when we say Advantage, this means a Part C plan. They have their annual Medicare Advantage OEP, open enrollment period. That is January 1st through March 31st. So people who have a Medicare Advantage can make a change at the end of the year between October 15th and December 7th. It goes into effect January 1st, but let's say that the person that you sold, or you just forgot about a drug, or you didn't know something, all of a sudden your doctor doesn't take this insurance. Well, that's where this annual Medicare Advantage open enrollment period came in, where now you can change and be able to go into another plan. They give you one opportunity. During the annual election period, you can change as many times as you want. It's just the final one that is recorded is the one that will stick. When we get into the annual Medicare Advantage open enrollment, all right, now what we're talking about is you have one opportunity to go ahead and make that change. So it gives us a chance to test drive it, see whether it works. If it doesn't, okay, we can go ahead and change it. We end up having newly eligible Medicare Advantage OEP, first 3 months in entitlement for Medicare Part A and Part B. So you also can get into a Medicare Advantage, again, with thinking of that 7 months. So you can have the 3 months. Again, we've talked about all of this stuff, and it has to do with individuals that are institutionalized. We're not really going to spend time on this. Institutionalized would be that you are in a facility here. Here are some examples of special election periods: move out of the plan's area, lose Medicaid, or you qualify for Medicaid, are in a plan that leaves the area, leave or lose your employer. They're 5-star. There's a rating of stars. If you suddenly have a carrier that comes in that's a 5-star rating, they give you a special election period and are sent a retroactive notice of Medicare entitlement. So sometimes they forget and don't give it to you. All right. So that is a big overview of original Medicare. So what we're going to get into is some more specifics. And what I want to do is be very careful about hanging out in these information, because most of you are going to have a Medigap or Medicare supplement plan or a Medicare Advantage plan. So these will go ahead and handle or pay for a lot of these out of pockets, but it'll give you an idea of what everything ends up being covered. So under Part A, hospital, first off, you got to be admitted into the hospital. So that's the operative word, admitted. My mother-in-law was in the emergency room. They kept her overnight. She was under observation. That wasn't considered Part A. That was considered still Part B. So what it includes: semi-private room, meals, general nursing, the drugs that are in there, inpatient care, and a skilled nursing. So we can go ahead and have, if you're transitioned out of an inpatient hospital into an inpatient rehab, all right, again, that's covered under Part A. We also have blood, hospice care, home health care. Oh, this is a big deal, because home health care, most of us think of it as somebody coming and assisting us with a daily living activity. That is not what this is. This home health care ends up being therapies that you can have when you're discharged that can continue at your home. So like physical therapy, occupational therapy, that kind of stuff. They can come to your home, give you your session, but it is not, we can help you cook and get around kind of thing. So that's a big, I wouldn't be surprised if in the near future they change the verbiage of that. Most people don't pay for Medicare Part A because we've paid for it already in our taxes. So if you've worked at a place or for yourself where you have given yourself an actual payroll, then you have paid FICA taxes, federal taxes, income taxes. One of those that you'll see on your check stub is Medicare. So as long as you've gone ahead and worked at least 10 years, they call it 40 quarters, but 10 years, then you're considered entitled. And if you're entitled, if you have that classification, then you don't realize a premium for Part A. But if you're not entitled, then they have different premiums, and this will determine on if you have any hours at all. Like, so if you're in between, I want to say 20 and 30, then they charge you a little bit, or they charge you less than the full amount. Between 30 and 40, again, a little bit less. You have to have the 10 years or 40 quarters to not have it. But if you're under 20 hours, then you're going to have to pay the full premium. And that, can be over $500. So just to let you know, you may have a penalty if you don't sign when you're first eligible for Part A. So now we're getting back to that initial enrollment period. You waited, and now you're past the last 3 months, and now you're enrolling in Part A after that. All right, you may end up having a 10% penalty on top of what you've gone ahead and already are paying. Here again is some good stuff for Part A, but I don't want to get stuck on this because most of us have other plans in place that will go ahead and cover this stuff. But in an inpatient, There's a $1,600 deductible under Part A. You have other coverage after the 60 days, but most of us aren't going to go ahead and do this. We basically have, 91 days to be in the hospital where we'll get some coverage for this. I like to also think of this as the 1,600 is a 60-day deductible. So if you go into the hospital, you pay your $1,600, then if you are discharged and you're readmitted within the 60 days, within 60 days of your discharge, then you won't have to repay your $1,600, and the clock resets when you're discharged that second time. But if you're admitted in the hospital after 60 days, well, then you would have to pay the deductible again. We have a lot of the same benefits for mental health. Here's our skilled nursing inpatient rehab. It's a 100-day benefit. Again, this is original Medicare. The first 20 days, it's a zero. So you wouldn't have any charges. Days 21 through 100, you have a $200 coinsurance per day. And then if you go over 101, you'll be in charge of all of the costs. Again, we talked about home health care, zero, hospice, zero, blood. If there's no charge, they won't charge you for it. If the hospital has to buy it, you might have to pay for it. Okay. So the first, it starts when the first day you get inpatient. So when you're admitted, all right, ends after being home for 60 days. Again, we talked about the 60-day deductible, if you will. You pay Part A deductible for each of the benefit periods and no limit to the number of benefit periods. But again, if it's after 60 days, you're just going to have to keep paying the $1,600. So do I need to sign up for Part A? It's free for most people. Again, entitled. I don't like the word free, because we paid for it in our taxes, but you can pay for it with your work history, as if your work history isn't sufficient enough, like I said, or you can talk to your benefits administrator. So if you're still working for somebody, that's what you should do. Or you have a retirement plan, you should go ahead and talk to your benefits administrator, because sometimes our cardinal rule is that if you're in a retiree plan, then we want to be very, very careful about moving you out onto an individual plan. A lot of times that can be very beneficial, but they may not allow you back into their plan. Once you're out, you're out. So that's a big deal that we have to take into consideration. Part B. I like to say that Part B medical is anything from, if you're not admitted in the hospital and it's not a prescription, it falls into this. Again, remembering that original Medicare was based on the old school of insurance, of being medically necessary. So again, here we go. Doctors, outpatient medical and surgical services, labs, durable medical equipment, diabetic testing. They have some preventive services, home health care. Again, we know about that, the therapies, medically necessary outpatient physical occupation, outpatient mental, limited number of outpatient prescription drugs. So, let me go back. We used to not have preventive on original Medicare, and this came out like in 2014 or something, 13, 14. And now we actually do have some preventive on here. Now, there is a thing called a wellness visit that is different than your preventive. The wellness visit is going to just be kind of how your cognitive is and how your living circumstances are. Preventive is actually it. And this is what you can get on an annual basis for no charge. And they are including now a lot more of these vaccines in this preventive also. But They will also sometimes have time requirements. Some of these you can get on an annual basis. Some of them you have to wait a couple of years. You can get it. It's something to remember. We used to say we'd get a physical. The physical was actually when they put their hands on you and check you out. It's not a physical. It's preventive. Essentially, we go and get our labs and they go over it, but we can get these other services if we need it, a lot of screenings. What is not covered under Part A and Part B, original Medicare? Again, dental care, unless it's medically necessary. Vision, unless it's medically necessary. Dentures, cosmetic surgery, massage therapy, routine physicals. There it is again. So how did they do that before we had Medicare Advantage plans? Well, they ended up saying it was an office visit. So, they couldn't call it a routine physical. Okay, so here we go. Part B is based your premium is based on your income, and they look at your income from 2 years ago. So we're in 2023. If your initial election period is in 2023, they're going to be looking at your 2021 taxes to see what your premium is going to be. The standard premium is $164.90 for 2023. They will also look at this for you being established in Medicare. So let's say you sold a lot of property when you were 65 because you were kind of cashing some things in for your retirement and your income looks higher on that. Well, they may charge you a higher premium, but then the next year you go back to your regular income and you end up getting the standard or getting it lowered. Now, again, there's exceptions to that can be argued that it wasn't, but so what we're looking at for the 164.90 is essentially, I'm not going to use a specific number, but if you are filing your taxes in jointly, if you made under $194,000 single, I think it's $94,000. It might be a little bit less than that, but if you made under that, then you will have the 164.90. If you made over that, okay, there are different levels, and it goes all the way up to if you earned $750,000, and that's going to get you for Part B into a $500 plus premium again. And so there is, though, what we have to keep an eye on is the standard premium, because that is a moving target. Last year, we ended up having a higher one. What was it, 172, something like that. And they lowered it this year. And they never do that, but there was some questions about, a drug that wasn't covered and stuff that didn't work. So now they cut us some slack. In 2024, let me look at my notes here. The Part B premium is $174.80. So not quite $10. They kept it right under a double digit, but it is going up. So everybody who's getting that taken out of their Social Security, or if they're getting billed that because they're not collecting Social Security yet, well, it will go up. Now we did get 3.8, I think, increase is what they're estimating for the Social Security cost of living adjustment, the COLA. And that is associated with the Part B premium. So this is all within the same act. So if you get an increase on your cost of living on your Social Security, you're going to get an increase on your premium because they're associated. Here we go. So 164. So it was 97. Forgive me. 97 separate or individual, 194 for joint. And we can see that it will go up all the way to a maximum of $560.50. So really where I find a lot of people in is kind of coming into this area where you've made more than the 97 or 194, and now suddenly you're paying $230. Again, these numbers are going to change next year because the standard is changing also. So all of this is going to go up. This is what I always try to tell people is we've got to talk to our representatives. We've got to be careful. Everything is sort of affordable now, let's say it. It's not crazy like the under 65 stuff is, but it's creeping up. Everything is creeping up. When I first started this, the Part B premium was like $61. Now that wasn't yesterday, but it was like 17, 18 years ago when I first started Medicare. So it's gone up and it will continue to go up, and we just have to keep it so it doesn't go up too much here. With original Medicare, again, please let's not get stuck with that. I've got this other plan, or I haven't seen this deductible or anything like that. I don't know what you're talking about. This would be if you just had Part B, all right? Original Medicare, Part A and Part B. You have a yearly deductible of $226. So there are no copays, there's no nothing. So the first thing that you would end up doing in a year where you are not admitted in the hospital and it's not a prescription, you're going to have to pay the first $226 of this. After the $226, then you split, you share in the cost of this. You co-insurance. That's where they come up with this word. 20% you're going to pay. Medicare will pick up the other 80%. What we don't see in this is there an annual maximum? And there's not. So what happens here is we could look at this and say, okay, 20% of what? Is there a place where it's going to stop and Medicare takes over at 100%? No, no, they don't. So this is one of the areas to be aware of if you're thinking of having just original Medicare without anything else as to what your exposure is. So again, we're looking at certain things, whether you're eligible for it, what is going on. In order to get a Medicare supplement plan, a Medigap plan, a Medicare Advantage plan, or TRICARE for Life, or any of these other, you have to have Part A and Part B. Whether it's your primary insurance or not is a second question, but we always start out on Part A and Part B, all right? Let me get through these guys, come on. Okay, any questions? No. Okay. Medigap or Medicare supplement plans. These plans are sold by private insurance company. And probably the most confusing thing that I see about this is that people think because they come from an insurance company that they have to include that in asking if the provider takes it. Because again, we've been conditioned this way. So I get my Medigap or Medicare supplement plan from ABC Insurance Company. Okay, I have original Medicare. Do you accept it? And I also have ABC Insurance Company. You don't have to do this. This is the only policy that ends up, the requirement is only if Part A and Part B ended up paying for it. That's the only thing they're looking for. So it works very much in tandem, but it is not health insurance. It's supplemental. It supplements Part A and Part B. And this is where we start to go ahead and get where we are hedging our exposure on this. Because like I said, when 20% of what? There is no end in that. That's where the Medicare, the Medigap or Medicare supplement plan will come in and end up limiting your exposure on this. These plans are standardized. So you get the same thing from every insurance company. You will not get anything more or less from one insurance company to the other. But they can charge differently. And that's a big thing. So what we're always looking for is, okay, what's our initial cost to start this? Because the premiums for these can be high. over $100 depending on which one you have. And this is on top of the 164.90. So we need to take that into consideration of what the different costs are for the Medicare supplements. Here we go. Here are the plans. Plan F ended up going away January 1st of 2020. A lot of people are on it. They're grandfathered in. That's fine. As you can see, with all of our benefits of the Part A, Part B deductible, the Part A co-insurances, the Part B co-insurances, look at F covered everything. The only thing we got to 80% was foreign travel. Again, that's an added benefit that these guys had. Plan G right now is the one that ends up having the most beneficial benefits, where it's 100% all the way down, except for the Part B deductible. So the 226, you would still have to pay the 226, but then anything past the 226 and and hospital is covered at 100%. So very low exposure when you end up incorporating this together. You can go see any doctor that accepts Medicare, but you are going to pay more for it on a monthly basis. I forgot to say that the Part B deductible, let me get my numbers here, is going from $226 up to $240 in 2024. So again, we would just plug that in here, that in 2024, you're going to have to pay the first $240, not $226. Again, another moving target that we've got to keep our eye on because it is creeping up. I'm not going to go through a lot of this because, again, this is what we start to talk about. Is this right for me? Is this the suitable one for me? Do I want to go outside of New Mexico? What are the things that I'm looking for? What's a priority for me for your suitability? This is what we come down to on it. Medigap, the open enrollment period ends up being the first of the day that you turn 65 or have Part B. And then it runs 60 days after that, or 6 months, I'm sorry. And so don't get this confused, because typically then what we do is we have everything starting on the same day. So again, with my example of April 1st, when my original Medicare started, then I would be enrolling in this to begin on April 1st, which is the first day of my election period. But again, I'm in my election period, so it starts the first day also. So everything starts at the same time. We've got the companies shopping around. Again, consider the plan and the price. I would say the plan because they're standardized, but the price certainly because it can be a significant difference from one company to the next. Okay, Part D. This is our prescription drug plan. Now, it ends up stating that this is an optional benefit available to all people with Medicare. So this is voluntary, but if you don't enroll in this when you are eligible, then if you enroll in it later down the line, then you will end up realizing a penalty. And we will get into that penalty as we get down here. The plans are run by private insurance companies. They're also known as prescription drug plans, PDPs. So when we go back to that page where I was showing you the most important slide, we had Part A, Part B, Part D, and a Medicare supplement plan. Okay, so we had a standalone prescription drug plan, but the prescription drug plan can also be incorporated in your Medicare Advantage plan. So it can all be in there. The same requirements, the same Part D is in a Medicare Advantage plan. They just may charge things a little bit differently. So again, here they're talking about a lifetime penalty. I think it says it later on, so we'll just go through it right now, but the penalty ends up being 1% of the national average premium for every month that you ended up not being enrolled. So when we're talking about the average premium is about $35 now. So 35 cents is 1%. So if you haven't had a Part D plan for the first 24 months of your Medicare, well, 24 times 0.35, and that's what your penalty, and it's a lifetime penalty, monthly lifetime penalty. All right. These plans have formularies. They have formularies or lists of drugs and how they're going to be handled. We used to say generics, preferred brands, brand name, specialty. Now we look at it more as tiers. Tier 1 is the old preferred generic. Tier 2 is just generic. Tier 3 is preferred brand. So that's again, the verbiage that they're using right now. There are monthly premiums for this unless it's incorporated in your Medicare Advantage plan and you happen to be looking at a Medicare Advantage plan that does not have a premium. So there are premiums, but they vary. And again, it varies by income also of how much you're going to go ahead and pay. There is a yearly deductible. Guess what? It's going up. This year, it's $505 is the yearly deductible. It's going up to $545. So when we're talking about a Medicare, a prescription drug plan, we have, this is where we used to have the proverbial donut. And essentially we had 3 phases of this. And you're eating one side, you get some benefit, you get to the middle, you get nothing, and you go to the other side and you get it. There are still just 3 levels of it, but they've incorporated this deductible in here. So it makes it a little bit different because a lot of these plans, if they have a deductible, they only apply to tier 3s, tier 4, and tier 5 drugs. So you would have to pay 100% of those particular drugs until, as a cumulative, you end up reaching your $505. And then it goes to either its copay or co-insurance. But there's the deductible falls under what we call the initial coverage. And that's going to be where they are looking at your copays, you're paying copays, you're paying insurance, you're satisfying your deductible. But when your costs and the insurance company's cost, so not just your cost, but when yours and the insurance companies reach $4,660, you go into the gap coverage, the second phase. We used to know it as the donut hole. Guess what? That number is going up it is going up to $530 in 2024. So it might take a little bit longer to get there. And then what we do on during the gap, you basically are going to pay 25% for your prescriptions until you end up hitting $7,400. And then you go into catastrophic where you're only paying about 5% for your prescriptions. Here becomes what we end up, again, we'll have increases. If your income is higher than these levels, you're going to pay more. So if you have a standalone prescription plan, and it's $10, and you made over $97,000 in 2021, you'll be paying the $10 plus the $1,220. Here is our late enrollment. So you won't get it if you have credible drug coverage. So if you're still working for a company, that's one of the biggest things you got to ask. Is my drug plan credible? You won't get it if you're on Extra Help. Extra Help is a federal plan that helps you pay for prescriptions. But here you do, the 1% of a full month eligible, the percentage that we're going off of in 2023 is $32. I said 35, so I was off by a couple of dollars, and that amount changes every year. So when this number goes up, that 1% applies to the larger number. So you can join, you have to have on a prescription drug plan, you have to have Part A or Part B, or Part B. So you don't have to have both A and B. You can have one or the other and have a prescription drug plan. But on a Medicare Advantage plan with a prescription drug plan, you have to have Part A and Part B. There's no or in that. We have a 7-month enrollment period for the initial enrollment period. So it mirrors the original Medicare. You can sign up during the open enrollment period, the October 15th through December 7th. And during the general election period, then again, you'll be able to enroll between April 1st and June 30th for a July 1st effective date.
So we have a question. I'll ask you the question. You can repeat it. Somebody wanted to know if they dropped their drug supplement, can you sign up without paying? You don't read that question.
So if you dropped your prescription drug plan and now you want to come back in, will you have a penalty? Yes. Yes, that was an easy one. Yes. When we end up talking about choosing a prescription drug plan, really, Medicare.gov has a great find a plan. You can put in your prescription drugs. Most of the carriers have this also. I tend to go to Medicare.gov so that, we're seeing everything on a non-biased nature, but you put in your prescriptions and it will tell you which plan would cost the least premium and the least at a pharmacy. And you can put in your pharmacies also. And so it really is a strong tool to use. And again, when we start to talk about suitability, then that's what we're talking about, is trying to make sure that you end up having a plan that's going to go ahead and... Are we sending this to everybody? This will be up online, okay? All right. Medicare Advantage plan. This is our last thing, and we've gone through a lot of this stuff. So I don't really see us being in this very long here. But here we get back to that side of that important slide where you have to have Part A and Part B. Most plans include Part D, and they have some extra benefits. They got to be as good or better than original Medicare. So again, we've been through pretty much all of this. We're going to be getting Part A and Part B benefits. They just are handled differently. Most of these plans have a copay, so you're not going to see that $1,600 deductible to be admitted into the hospital, because these guys have it actuarially figured out a different way where it's only going to cost you $300 a day for days 1 through 6 in the hospital. So they have to give you at minimum the same benefits as original Medicare. They just figure it out differently. So everything is pretty much covered by a copay, and sometimes they have a deductible in there, and sometimes there can be a premium for this. But in most cases, you'll need to use the healthcare providers who participate in that plan's network. Bingo, here we go with our network. They can have 2 different kinds of networks. They can have a health maintenance organization, an HMO. They can have a preferred provider organization, a PPO. So what's the difference? The HMO plans are a more confined network. So usually it's a regional network. In my analogy of the funnel, we're getting down into a lower place, into a lower spot of the funnel, but we end up having, the insurance companies aren't idiots about this. These are the ones that offer you the biggest bells and whistles, the most optional benefits. PPOs, typically what we're talking about is that you have 2 sets of benefits. One is for contracted in-network. One is for non-contracted out-of-network. The out of network is going to be significantly less because they lose control over that, but you still have something. And you also will have a national presence. So it takes you from here up to here. You're not at the widest mouth of the funnel quite yet, but you can get a national presence on this. So again, with these plans, you have to have the same rights and protections as Medicare. You still get the services that are covered under Part A, Part B, original Medicare, can't be charged more than original Medicare, may choose a plan that includes drugs and extra coverage. You might choose not to have it. Can be charged different out-of-pocket expenses. So again, the copays can be higher. The annual out-of-pocket maximums can be different also. It's just how the insurance carrier has produced it. And a lot of the insurance carriers have numerous Medicare Advantage plans. We have to work within a service area. So again, the first thing we'll ask is, what is your zip code? So we can see what plans are available. A lot of plans are for metropolitan areas, and then they have different plans for more rural areas. Again, we may end up having to work with a PCP. Medicare pays for fixed amounts for your coverage of a company for a Medicare Advantage plan. That's how, when people say, well, how can I get this for a zero premium? It's because Medicare, the trust fund, is sending money to the state that is divvying it up, and the insurance companies are getting paid. It ain't free. It's never free. You can join during AEP. Again, there's the general election. I'm new to Medicare and join a Medicare Advantage plan. When can I change? You can change during all of those times that we've talked about: the open enrollment, the annual open enrollment, or even a special election period. So same thing. Will I have an open enrollment period? Will I have a special enrollment? When a 5-star, these are all special election periods that in which you could change your prescription drug plan. You would have an election period. Find and enroll, again, Medicare.gov ends up being a great place to go for that. And things that you just need to consider, again, when we're going through this, is the extra benefits with Medicare Advantage plans. What are the extra benefits? I need a lot of dental done. Okay, let's pick a plan that you can use for your hospital and medical and prescriptions, but let's also find something that will apply or be suitable for you for your dental plan. We got to look at the networks. The HMO networks, typically you can go to one or the other hospitals. That's what they have. PPOs a lot of times will incorporate, like, all of the hospital networks. You may need a referral from the specialist. You can only join and leave the plan during certain enrollment periods. We've already gone through all of that. And it is different than a Medigap or Medicare supplement plan. So if somebody is trying to go ahead and say you've got a Medicare Advantage plan, oh, you should buy this supplement plan, you can't. It's illegal to do that. So you have to have one or the other. And that's kind of why on that important page, there was 2 separate sides. It's either or. It's not both on those.
Ease of going back and forth between one of the two, because you could easily go to an Advantage, but not necessarily they have to Medicare. Isn't there underlying it?
Correct. So with the Affordable Health Care Act, we cannot discriminate based on health for health insurance. So out of all the things that we have discussed, Part A, Part B, Part D, and Part C are all health insurance plans. A Medicare supplement is not health insurance, it's supplemental insurance. So on a Medigap plan, you are guaranteed issue when you are applying at your initial enrollment period, that first day that you have Part B, and then 6 months after that. But after that, then you'll continue to have it. They can't take it away from you. But if you were to go to a Medicare Advantage plan, then that's a guaranteed. I could guarantee, as long as we're in the enrollment period, because a Medicare Advantage plan, Part C, is health insurance. But coming back from that, then the insurance company is going to go ahead and underwrite you for the Medicare supplement plan. Now, that's not a deal breaker, but they can go ahead and charge you higher premiums, and they can go ahead and deny you coverage. So I can still get you, you can still be on original Medicare as your primary insurance. You can still get a Part D plan, but you can't get that supplement. So my four-legged stool, you only have 3 of those. Not horrible plan, but you've got to know about your exposure and what your out-of-pocket expenses are going to be. So great question on that one. Something to think about with that. Again, like I said, this stuff is a lot of repetitive stuff. What the difference between a Medigap and a Medicare Advantage plans are, they are both offered by private insurance companies. They're governed, their oversight is a little bit different. It works with original Medicare, the GAP does. The Medicare Advantage plan, you have original Medicare, but you do not access any benefits from it. Even though you got your red, white, and blue card, and even though you're paying for it on a monthly basis, you don't get your benefits from original Medicare. You're going to get it from the insurance company. So it covers the gaps, covers all Part A and Part B services. A Medicare cost plan is not available in New Mexico, so we're not going to go through that. PACE is available in New Mexico. This is a program for all-inclusive care for the elderly. It's a state-run program, and they do all of the benefits combined, but you've got to go to their areas. So if you qualify, then it ends up being a good thing, but it is a little bit difficult to qualify. So that's everything on Medicare.
That Presbyterian did not accept Medicare. And I said, well, that's not true, because they do accept Medicare, but I think they were referring to the fact that Presbyterian has their own Medicare Advantage program, and they won't accept St. Vincent's Advantage.
Oh, exactly. So you were talking to somebody and they said that Presbyterian Hospital does not accept Medicare. And that's not true. We're getting into those networks. So there are different Medicare Advantage plans we can access Presbyterian Hospital or Christus. And then there's other ones where we can go to both of them. Exactly. So that's not true about Presbyterian at all. So again, I threw a lot at you, and just to summarize, I just want you to remember that this is how it works. So if you're talking to somebody and they are saying, I'm paying this much for my Medicare, and somebody comes back and says, no, what you're getting, that I'm only paying 0 for it. All right, they're not including the original Medicare premium. People handle it differently. They can have the four-legged stool. They can have Medicare Advantage plan. The information you're getting in the mail, the phone calls you're getting, all of that stuff has to do with the benefits that are coming from the insurance company. You're not really getting anything from Social Security Administration or Centers of Medicare and Medicaid. They will email, but that's where the scams come from. I saw a letter the other day from the Social Security, what was it? Not administration, but association. And it looked like a Social Security letter. So you have to be aware of these things, because original Medicare, they're not really going to go ahead and be reaching out or calling you for anything. you can always call them to be sure. But it's those other things. It's the Medicare supplement plan, the Medicare Advantage plan, the prescription drug plans. Those are coming from the insurance company. And that's the marketing that's making this confusing, thinking that this is Medicare. No, it's a part of Medicare on how you can design your plan. And that's how it is. So everything I've told you, when you're looking at the mail that's coming to you, and a lot of these insurance companies have numerous prescription drug plans and numerous Medicare Advantage plans, they will be sending you information on all of these. So every day you're getting something from the same insurance company. It's all about this other stuff that we need to look at, and suitability is the big word. Other than that, I mean, it's real simple.
You just touch the very end on pigs.
Mhm.
You gave us about 10 seconds on it.
Well, it's not because PACE. So you were asking to go back and discuss PACE. Well, PACE is an all-inclusive program run by the state. Okay, so if you qualify for that, and again, we're talking about lower income and health issues, that this then becomes your primary insurance, but it is an all-inclusive where they will offer the medical, they will offer the dental, but it's not a network. It's a facility that has a dentist in it, that has a doctor in it, that has this, and they handle all of this themselves. And the benefit is you get these services, and they have transportation to these places. So it's comprehensive, but with any, how do I say this nicely? Any program run by the state or any other municipality, there are challenges there. You might be used to a certain level of care, and they're saying, okay, we don't think you need dental right now, so you can apply, we'll get you a dental visit in 6 months. So it's something you're at their disposal, but it's all inclusive. Everything is included, and it takes over from your Medicare. So you don't have other health insurance. It is your health plan. There's one in Albuquerque. Mm-hmm.
They are not common.
They are, thank you. That was probably where you were coming from on that. Hmm? Yeah, look up New Mexico PACE and it'll come up and it'll tell you about it. But again, we're talking like the VA. VA sounds great as long as you can make it to a VA facility and get your care there. It's the same idea with PACE, that you're going to have to go to that facility to get things taken care of. I have a good friend that we put on PACE. It worked out very well for him. It was just a slow process to get him care. And we ended up moving him out of PACE so that we could speed up his care. Let's say that. Look it up. Definitely look it up. Any more questions, Ann, or how's my time that I owe? I think what I really want to do is it October 18th? Is the 23rd is our original Medicare versus Medicare Advantage plans. So a lot of these slides that we kind of blew through on comparing the two, we'll be going over this, but this is such a good program seminar to teach you about it. Everything seems so confusing when you're getting inundated with all of this information. Honestly, you need to push that all to the side. And it's a simple program. It's a simple process. You just have to know how to do it. And that's what this program is all about, and why the Villages of Santa Fe goes ahead and allows me to have this, so that you'll have some understanding about this. I did not put up my phone number during this because this is an educational piece. I am not here to sell anything. If anybody needs any assistance, certainly, I will be able to get a hold of, but this is not a sales presentation. This is just educational. So I want to thank Ann and the Villages of Santa Fe for allowing me to do this. Please tune in to our original Medicare versus Medicare Advantage plan. And if we don't have any further questions, then I will let everybody get back to their tea and Jeopardy.
And if you do have any questions, you can either put them in the chat, or I'm going to put this on speaker view or gallery view. And if you have any questions, just unmute yourself and ask your questions. And I would love to see you in a couple of weeks as well.
Bad joke, bad joke.
This online presentation probably tomorrow by then. There'll be a lot of emails that you can check in with, but we really appreciate you coming and join us in a couple of weeks. Thank you.